Are we ready?
Just waiting for Tracy to let me know that it's streaming.
Okay.
Don't want to break any of those open meeting laws.
Is that noise from, okay.
Is that Mike Nolan?
There was no name on it. It was just a phone and sound, and that was it.
Okay.
That's a 504 number. I don't, unless Mike's changed his number. He's a 225 area code.
Okay, you're right. And there's Blake. I got Mike. Okay.
All right, Raymond, you're good to go.
All righty. I'd like to call this meeting to order. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Jacinda, please confirm you verified the identity of all tele and video conference participants.
We just need to verify who is 504-239-0239.
Can you please identify yourself? Area code 504-239-0239.
If they can't identify themselves, just close them out. They'll call back.
Okay.
Is the sound clear and audible to the public and those on the tele and video conferences?
Yes, sir.
Yes.
All additions to the executive or public agenda must be made presently, as we will no longer make additions to the agenda after the close of the public session. Does anybody have anything that they'd like to add to the agenda? I have 2 items I'd like to place. One, I'd like to add to the agenda discussion on compact licensure. The other one is our next meeting date for the rules and regs is scheduled for July 15th. I will be out of town on that day. I think Diana Marandino will be going as well. If the board has openings on July 22nd, the following Tuesday, I'd like to see if we can move the meeting then. So I'll need a motion on the floor from someone.
And an opportunity for public comment.
And there are no public comments at this time.
Okay, so
accept the changes Raymond stated.
Okay, I have a second from Blake. All in favor?
Aye.
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 Any opposed?
Still won't be off of vacation, but y'all go for it.
Okay, thank you. Okay, Diana, can you do a roll call and a quorum confirmation, please?
Okay. Sheila Guidry.
Here.
Diana Marandino. Here. Blake Nolan.
Here.
Michael Nolan. Raymond Peasany.
Here.
Brett Stafford.
Here.
Jim Lenahall.
Here.
And Dr. Ugo.
Here.
Okay. And then from the LSBME, I have Patricia Johnson, Ron Kayette, Lauren Suduth, Melissa Genders and Jacinta and Dr. Van.
It's
Yes,
Phyllis Johnson.
I got you, Phyllis. I called you first. I'm sorry.
Patricia Johnson.
Oh, I'm sorry.
That's all right. That's
It's
all right.
Phyllis, hey,
I understand.
okay, we have a quorum.
All righty. We'll move on with the public session, the minutes of the March 20th, 2025 meeting. Has everybody had a chance to review those? If so, we can get a motion to approve.
I motion to approve.
Second.
Do I have a second from Blake? Any discussion? All in favor? Aye.
Aye.
Any opposed? Motion carries. Rule changes review. Do we want to go through the agenda first, Dr. Collada, of the other stuff, or do the rules?
That's your call, just whatever you want to do.
Let's go ahead and do the rules since we just have a little section left of that, and then we can see what else we have to discuss with that.
Since y'all met when I wasn't here, what is the last thing y'all did? So I can bring it up on the screen.
We stopped at, it's page 18. What I'm seeing, it's subchapter B, subsection 5507, exemptions, number 4, if I'm not mistaken.
Dr. Van, I'll share my screen so I can make the edits in real time.
And I'll stop my sharing, you do it. Thank you. Perfect.
Alrighty,
Makes my life easier. Appreciate you.
of course. Oh, sorry. Hold on 1 second. Let me put these people.
It's page 18.
18. Okay. Yeah, here we have the end of the 520 meeting.
Yeah, so the last thing we stopped, oh, wait, go back up. The last thing we stopped, and you can stop, was number, subsection 5507, exemptions. We stopped on number 4 at last meeting.
Are y'all good with keeping the exemptions as they are and then moving on to prohibitions?
Well, I don't like number 4. I have never liked number 4, but I don't think there's a way that we can get around number 4.
And why is that, Diane?
And I brought this up, and this was years ago. Okay, so basically, let's just say I go to my internal medicine doctor and I got a history of smoking and he wants to screen me for spirometry in his office.
This doesn't prevent him from doing that. That's already in his practice act, is it not? That anybody can do anything in his office?
And the point being, it's his next door neighbor who's 20 years old and working his way through college. That person can do my screen.
Right. Right.
So
So how does deleting this prevent that?
Dr. Collada? I think you had
Okay, you're crossing over into, and I think Jim's on the right track, and
Yeah.
Miss Lauren will correct me if I step on pieces of my anatomy here, but we have a concept in the Medical Practice Act about delegation. If I am in the office supervising and available to supervise, I can delegate that to anybody that I train and teach to do it.
Amen.
So but if I'm not in the office, they shouldn't be doing it.
And this is my problem. We all have to remember that the physician's office is not the only place PFT screening takes place. You got every chemical plant out there, especially in the state of Louisiana, that does this stuff on a regular basis.
They should be having a licensed respiratory therapist or a physician on site that's supervising.
Thank you. I'm with Sheila. I'm aging myself, but I was around when this discussion came up in the very beginning, and I have always had a thorn in my butt because of my perception of why this was in there to begin with. I am here today to say I'll put a motion on the table right now as a voting member of this board to delete that.
Sheila?
I'm thinking on it. I know where Jim's coming from way back. Respiratory therapist
Dr. Ugo, what do you think?
rules. Who is employed?
I'm reading it right now, so I'm trying to. I've been processing it this whole time.
Okay, give everybody a few minutes. Diana, can you mark that Michael Nolan is on the call?
Yes, thank you.
I'll just say I'm inclined to agree with Jim just because it's eliminating a redundancy, as I see it.
Who's employed in pulmonary lab or prison to administer treatment
I
confined?
have Blake, but I don't see Michael on my screen. Is there? I want to.
All the
He's
way
on,
to the
at the
bottom.
bottom.
Okay, he's just peered up. Okay, got it. He's just showing up on mine. Thank you.
Michael, can you identify yourself?
Audio check.
No,
Okay,
here
thank
it is.
you.
I'm clear.
I can hear you, Jim. I can hear you, Raymond, Diane,
Thank you.
Blake.
So Jim, by deleting this, we're saying we don't want that to be regulated at all. Anybody can do it.
You're on mute, Jim.
It doesn't say we don't regulate it. This is all lined out in your scope of practice, is it not?
Yeah, Jim's saying if we delete it, then the 20-year-old neighbor who has no training, even if he's under the licensed physician, he can't do it unless he's a licensed respiratory therapist.
No,
No,
no.
that's not what it's saying. What it's saying is the doctor can still delegate if he teaches and is responsible and presently supervising in the office. The real issue is the pulmonary laboratory. If the pulmonary laboratory does not have a licensed person in it or a physician that has delegated that authority, they can't do it. So if a chemical company, as you were talking about, has a respiratory therapy or pulmonary laboratory to test, but does not use a licensed respiratory therapist, they are in violation of your Practice Act, and they have no doctor, so they're in violation of our Practice Act as well, if they wanted to use it that way.
That's my point exactly. This is a very large petrochemical state, and I know for a fact that even in our state prisons, there are PFTs done by licensed respiratory therapists.
That are done by licensed respiratory therapist or not?
Yes, they are, Sheila. They are.
Okay, so Jim, let me ask the question, because again, and my head's spinning. So when I read this, these are exemptions. Number 4 says these people who are not licensed as a respiratory therapist can do PFTs under that physician's guidance. That's what number 4 says. They're exempt. They're exempt. We don't even look at them. We don't care what they're doing. The physician had them in. The physician trained them. They're not a licensed respiratory therapist. So They're exempt. That's what number 4 says.
But that's redundant. It's not needed in this practice act, and there is the possibility that this could be looked at differently.
Yeah.
Okay, so I'm putting a hole in the dike.
Yeah, as Dr. Kalata said, this is covered through the practice of delegation that's outlined in the Physician Practice Act, correct?
Okay.
Correct.
So
I'm okay
technically-
with dropping it.
Okay.
Dr. Kalata, you had something you'd like to add?
No, I think what I was gonna say is what Ms. Dina was just saying. Technically, you don't need it because the practice under the physician is covered in the Medical Practice Act. This is recognizing that the Medical Practice Act has that exception. The issue is the pulmonary laboratory. If you still keep it in, it doesn't matter because the way the pulmonary laboratory has to have an immediate supervision of a licensed physician as well. If you take it out, it doesn't draw any attention to anything like the pulmonary laboratory. And if they're doing it and there's no doctor there to immediately supervise it, we get a complaint, we deal with it.
So
This
it's
section is
redundant
always,
anyway.
this section has always caused heartburn over the year because it always, over the years, we always get wanting clarification on this, so I agree with Jim, and Dr. Kalata. I think doing away with it does no harm. It's already in the scope of practice, so I think we're covered.
I agree.
There was a motion by Jim and a second by you, Raymond, and you can call a question anytime you want. But first, let me check for any public comment. and I'll
Comment.
Do that right quick. I can't get it. And there are no public comments at this time.
So at this time, I'd like to call the question and take a vote, please. All in favor of deleting number 4?
Aye.
Aye. Any opposed? No opposed. The motion carries. We can go ahead and delete that section.
Done.
She's so happy.
Alrighty. So we can move on then to 5509, prohibitions.
Don't we have something that's further up in the law that we address who we can take orders from and all that?
Yes, we do.
Because we discussed that
Okay,
in
that,
the last meeting or the meeting before.
yeah, it's subchapter H. Um,
Is that 2575?
2575. All the way down at the bottom. That number 6.
Wait.
As a matter of fact, I had a question mark next to this section to ask because we're saying that we have a question. Can we do this? But where did we answer what the statement's going to be?
So do we really need number one since we've addressed who we can
Well,
take orders from?
I think that 25, 75, and I'll ask Lauren to weigh in on this as well. That is talking about supervision
Of a student
of
Oh,
a
yeah.
student. Yeah, and this
Right.
one is the respiratory therapist.
themselves.
Okay,
Yeah,
all right,
this
go a
is
little
the
bit further
actual
down. Okay,
practitioner.
go back up a little bit. Okay, stop right there. Let me see some. Further down. Stop. Okay, I'm sorry. I saw something else I was looking at.
Okay, so in our definitions, back on page 2, I'll read it. You don't have to flip back to it. It says respiratory therapy, the allied health specialty practiced under the direction and supervision of a physician involving assessment, blah, blah, blah. Such therapy includes, not limited to, upon the prescription or other order of a physician, advanced practice nurse, or physician assistant, whosoever communicated and duly recorded. And then it starts talking about everything we do. So at the bottom of page 2, with the definitions, it says we are operating under the prescription or order of.
But again, I would call your attention to, in the prohibitions, there's an issue of administering a drug. So respiratory therapy is not necessarily that the chapter or that section definition does not talk about administration of drugs. And this prohibition says that they can't administer drugs unless dispensed by a pharmacist and prescribed by a physician. Advanced practice. So if nothing else, you need to leave in 2.
And 3.
And I like 3 in there as well, okay?
But I'm sorry, Dr. Van, but the other thing that's sticking out, and I've read over it, we added certified nurse anesthetist to this, because if the CRNA brings somebody out of surgery and we got to have ventilator orders, and they were the ones sleeping them in the back, I don't know. I don't know if the physician has to come out with the patient. That's what's different with this one.
In real
Yes.
practice, now you know what happens. They come out and we stick them right on the vent, and the
And they get
CRNA
ordered to
oftentimes gives us orders.
All right, so where would you want to put that? In this one, in section 5509, because that would cover it under 5509. Because
I think it
they
needs to
shall not
stay.
undertake to perform the activities of these rules except on the practice, and you got your certified nurse anesthetist there. Or do you want to put it in respiratory therapist as well, or just leave it where it's prohibitions?
Hey, can I jump in for a sec? Because I was worried about some terminology too, so I was doing a little research here. But it looks like if I'm reading, I was checking out here, like the AMA medical group says, so an APRN. So what all classifications fall under that? And it's saying an APRN is an advanced practice registered nurse, with the subset of medical credentialing is the nurse practitioner, one of the 4 types of APRNs, and they list certified nurse midwife, certified registered nurse anesthetist, clinical nurse specialist, and nurse practitioner. All should fall under that APRN realm, if I'm reading that correctly.
You are correct. You are correct.
Thank you.
Welcome.
So do we want to get rid of the CRNA thing language if that's redundant?
Yeah, I think that's
I think
redundant.
so.
Well, and I've got a question about number 2. So what are we using as the definition of as dispensed by a pharmacist? So like for oxygen and other gas administration, that's generally done. I mean, obviously it's piped in and we do have orders. Is that going to interrupt anything with like Heliox or something where pharmacy really doesn't have anything to do with it?
No, this is when they give IV push meds and that kind of
Okay,
stuff.
okay, so this is strictly, okay.
Yeah, in other words, it's a code. And right now it's just me and you at the code, okay? And we're working the
Yeah.
code. There's nobody else yet in the room. And I say, we got an IV, or you got the crash cart, give some
Yeah,
epinephrine.
slam them. Okay.
Okay, that's what that covers.
I'm good with it, leaving number 1 in after we took out the certified nurse anesthetist. And again, thanks, Brett, for clarifying.
All right, is there any more discussion on this 5509? All right, we can move on to 5517 under C. What about the temporary licensure or temporary work permits, Dr. Collada?
Well, we're not gonna, we're gonna make it permissive. We're not gonna make it mandatory, because what I want to be able to do, you have to learn from your mistakes, is we can if another COVID occurs or a hurricane wipes out the southern part of the state, we can say these people can work on temporary permits until the emergency is over or the declared emergency is over. Sometimes the emergency declarations don't address everything. So we have that ability to respond even before the emergency declaration is in. We can say, look, in this situation, we're going to grant temporary permits to get everybody to work. And we all recall, before we knew that all of that pressure and volume was needed in COVID patients, we had hundreds of people on ventilators and it just wasn't enough people to maintain them. That's when we let all those students get paid to do the work. So this allows us to do it by making it permissive. Our goal, however, is to have everybody certified, and that way we don't grant the license until they're certified, except in real necessary emergency situations.
Okay. So is everybody good with leaving that as is?
Mm-hmm.
Yes.
And 5519?
Yeah, that's just pretty much what we do for everybody.
I'm good with those.
Looks good to me.
Okay.
Okay, so we're done with that. And then I think that there's a couple of issues that we were working on before that we needed to circle back to, right?
The
Correct.
stuff you'd put in yellow.
Yeah, so let's start from the top.
Okay.
I think this, we had the discussion on if we were gonna go to strictly registered respiratory therapists versus licensure, that'd be the basis for licensure in Louisiana. But I think after a round of discussion, I think we came to some conclusion that that might not be the best route to go, and we'd leave the CRT as the minimum level of education. So
I agree with that. I mean,
I do too.
I do too.
I do too.
Makes a lot of sense.
so number 5 should say possess current credentials. It does, as a certified respiratory therapist, and then you can take out the blue.
And then is 4 good? So we're changing for entry level to for registered credentialing?
no,
Or you want to just
No.
get rid of that?
the minimal it should be For, let's see, be a graduate, have a
And if you
requirement.
say entry level, you're covered no matter what happens in the future.
Yeah.
We'll throw that out
Yeah.
there.
Correct.
Okay, so we'll go back to the original change,
Yes, ma'am.
the original wording. Oh, okay.
Okay.
Oh,
Highlight that anymore.
Same
And
thing.
then same thing here.
Yes, ma'am.
All right, same thing here.
Mhm.
What? I'll go back to that. Alrighty, so that's good on that. I'll go back and change all of these. We don't need to go through every single one of them.
Okay.
Alrighty.
Which one? Let's see the board. I think we had questions on this from for Dr. Collada that we couldn't get. We're not doing audits. Is the board doing audits from CE broker?
Nobody can renew unless their CE broker account is current with the required amount of continuing education. Not only does CE broker track it, but it verifies it. So we have verification, and then we have the built-in system where it says what happens technically, so you'll understand, and I'll make it simple. When you apply to renew a license, the first thing that happens is our computer connects to CE broker's computer and finds out if you've done your CEs, if they're in the system. If they're not, it's a hard stop. We say you can't renew until you complete your continuing medical education requirements. And then when they finish, they can complete the renewal application and pay and get a renewal license. So a lot of times people wait till the very last minute, and at that point, they can't renew until they do it. And sometimes they go over midnight, and then they get mad, but that's the rules, and I got to make sure they pay twice.
Jim?
Yeah, I have a question. Thank you. I was talking to a colleague who's in another state that's also on their state advisory committee to their licensing body. And they just went to CE broker this year. And what this person told me was that if you go into CE broker, they actually uploaded a picture of their grandchild as their CE and put in a bunch of information, and it took it.
Okay, so let me give you the process. Not all states require verification, okay? So basically, you can upload the wrong file, just like you suggested.
Okay.
Louisiana contracted with them to do the verification as well.
Oh, wow.
They're
Okay.
actually checking. For example, Florida does not require even the physician verification, just upload, and they trust everybody. We
Okay.
take a little extra step to do the verification,
Gotcha.
so you'll know.
Well, thank you so much, because I'm going to get back with that person and let them know maybe they just need to upgrade their system. But thank you so much.
You know, again, when CE broker first came out, they were the only one, and we made an agreement and we got our pricing and what we decided to do with it. And then all of a sudden there were a lot more, and people said, well, why don't you go with us? I said, because you can't beat the price. And we even had one company challenge the fact that we even had a valid meeting to do it. So we worked with CE broker since the beginning. Probably y'all don't remember it, but it really started before COVID, and we kind of suspended a lot of stuff during COVID and trained people and used the COVID 2 years to train everybody how to use it. But again, once we went live and in real time, they're verifying. For example, you have a certain number, a certain how I'm thinking the wrong word, forgive me. You all have determined what kind of CMEs you will accept and from who that certifies them. We remember years back, we used to do mom and pops, and we used to take applications for mom and pops. Now we don't do that anymore. We have certain accrediting agencies that you have told us. And so if you wanted to change them, you'd have a motion, we'd go to the board would approve it. That tells CE Broker, we no longer use this organization, we only want CEs from that organization. So I can tell you that we set ours up so that it verifies all of them. Florida, for example, does not verify.
Okay, so let me ask a question, and again, this is going to a lot of trouble, but this is, I'm thinking very extreme here. So for our Tri-State Respiratory Conference, we file all that with the AARC, but we will also give out a certificate that says we have granted 10 CEUs, and it's AARC, and there's even, I think, a course number down there. And so I get 5 CEUs. I got to have 10. If I replicate a certificate, throw AARC name on it, make up a number of a course and submit it, they're going to see AARC and they're going to say she's good to go, right? Are they going to follow up with the number on the course and go?
Let me say this to you. They generally have the ability to, for example, what you all ought to be doing is say, AARC work with CE Broker and they send them directly. You all don't have to give them certificates, okay? And that way you can eliminate that concern. Some people still give certificates, and when they get certificates, and I will double verify for the next meeting, they are checking with AARC if this is valid. The course numbers are valid.
Okay.
So that brings up a good point, Dr. Vance. So you're saying that the course sponsors, such as the Tri-State organization, could link up with CE Broker and have those certificates and have that stuff uploaded.
Exactly. You say to everybody who participates at the end of the course, turn in your things and we'll send this directly. You will not get a certificate. Turn in your, you have to take the poll at the end about the adequacy of the course and all the things that have to do for valid CME. You take those, and then the next day you just transmit electronically a file to the CE Broker with all of the people that took the course. And you don't have to worry. Makes it so much easier for your licensees.
So I guess
that's been available since the beginning. And for example, the American College of Surgeons has adopted that. And the big problem is the ACGME was late to the game, and they're doing it now also. But because we have so many other licensees besides physicians, we elected not to go with ACGME and still have the direct report to CE Broker.
That's how the real estate industry in Louisiana operates. Exactly. It goes straight from the course I take to CE Broker.
So do we leave C in or delete that? About the board or the advisory committee shall randomly select for audit no fewer than 3% of the licensees each year for the audit of CEU activities.
I would say delete it, because we are basically, by the system we set up, getting 100% audit because we've contracted with CE Broker to make sure those are verifiable.
Should we leave in part of that second sentence? The Board of Advisory Committee has the right to audit any questionable documentation of activities.
Yeah, I was going to say, take out the first sentence. We're not going to audit. However, we have the right to, if there's questionable documentation. So
Dina, I hear what you're saying. As a practical matter, what would be the reason?
You know, Dr. Kalana, I can dream this stuff up. Brett Stafford comes into his department and he hears me bragging about how I just went on and uploaded this stuff and got my CEUs and I hadn't done anything. And he overhears this. So he could actually go back and ask the board, can y'all go back and pull what she submitted so that we can just look and verify this? Because she sure was bragging about how she's making crap up. If it's the first part makes it sound like we gotta do it.
Mhm.
The second part says if we needed to, we have the right to do it.
And I agree with that because look at how many over the last 8 years, how many chart audits we did and how many we called and had to pull back that were inaccurate.
Right.
We had a stack of them each time we did it. It wasn't 1 or 2, every 3 months. We had a stack of jokers.
What
Okay,
is our current percentage that this automatic auditing program has revealed? What is our current outline? Nothing is perfect. I'm assuming we're not at 100% compliance.
Well,
Okay, here's the way I understand it, and I will verify it for our next meeting again. But the way we set this up is that you all have determined what agencies you will recognize for that approves the CMEs. We tell CE broker. They then verify that everything is submitted is appropriate. They then make your CE account show the proper number of hours that they have determined to be verified. At that point, it sits idle until you reapply. And then when you reapply, if you don't have the required number, you can't renew.
I understand that, but I guess my question is, have they ever been able to identify someone who was attempting to be fraudulent?
Well, again, what happens is when you submit something that's not recognized, they drop. It doesn't.
So they don't notify us that Joe Blow is trying to.
They don't necessarily notify us, but what they do is they don't add that to the total. So let's say somebody says this is such and such, then they go to verify it and it's not true. They just say we couldn't add that to your total.
Okay, but can they tell us how many were applied that were not added to the total?
Well, I guess we could ask them to do that.
I would really like to know what that information is, because if they're dropping off a bunch of them, like y'all are telling me, I just came on this committee, then we need to continue to somehow audit this. But if they're only dropping off, 2% in common error, that's appropriate. But if we're finding that they're dropping, 15% of all these applications from one geographic area, we got an issue.
Well, again, I'll see what they can do to give us that information and I'll get back to you at the next time. But I mean, it is my understanding that if it is not, for example, if I submit an AMA, and they know the course number and it's verified, they're fine. If I submit something from a medical school in Botswana, and that's not part of the thing, it's immediately rejected, okay? If I forge something, see, I send transcripts, and they can verify very easily the transcripts. I submit all of my required and even more in about 2 minutes because I just upload transcripts. But if somebody sends a certificate that they can't verify, they just say it's not verifiable. But I'll get back to you if they keep a record, and if you want to keep a record, we'll do it.
I think we should, because right now we've got no way of knowing how many they're turning away because they're not acceptable. And I just would like to see a number there, 2%, 15%, how much, something.
I agree, Jim, because if we ask them for that information and they come back and say 100%, they haven't turned down anybody, then I have to question this.
Yeah, that's my point. That is my point.
Yeah.
Well, I know when I've submitted to CE broker and, had a mistype, or I believe what I did was I uploaded the wrong certificate. It did, like you said, Dr. Collada, it didn't, flash and bang. It's just when I updated the number, my number did not change. It never changed from 7 credit hours to 8. And that was my cue that something was wrong.
Right. So I do know that they verify, but and again, because we don't accept them if they're not verified, we don't keep a record of it. And if it's going to cost me money to keep a record, I'll have to figure out how much it's going to cost. But again, we can certainly look into it, because the way they do it, if it's not something that they verify, and of course, I'm sure they're using machine learning and AI to do it. But again, it's a lot easier for them, because they have all these interconnections with these agencies, to just click in and verify with APIs like we verify with them. So that's what we're paying them for. Okay.
Yeah. If
But
they
I'll
could just
get it-
dump all
I'll get
those
it.
into a box, an email or something, that'd be great.
Well, I guess
I'll
my
get you for
question is, do we need to know the rejection rate? Because it's not giving them the credit hour, so they still have to submit their 10. One
Right.
way or another, they've got to get 10 validated certificates. Now, I guess it might be a way to identify fraud, but the system's pretty solid. I mean, there's always going to be ways to fraudulently do something. I don't think we're ever going to track down every fake. I mean, you get a fake passport and a fake identity and become a therapist if you're clever and resourceful enough. But at the same time, I think, what purpose are we going to use that for? Is it just a, quality improvement measure on our end? Because at the end of the day,
It's
they've
an
got to
outcome,
submit
it's an
10
outcome
reviews.
measure. It's an outcome measure that proves that our auditing works, or it's an outcome measure that proves to us that we need to start doing some manual auditing or something.
Yeah, it's like a trust but verify on CE broker, basically.
Okay, I would suggest that we leave this section in for now. And if Dr. Collada, you can get us that rejection rate for our next meeting, then I think we can further discuss this section. Is that
And
okay
you
with the committee?
Now, and let me ask you something. When you said geographic location, we only do Louisiana. So do you want to know what the telemedicine people do? I mean,
Oh, Lord. No, you're not gonna be able to do geographic location. I'm just thinking, in my mind, when we see issues like this throughout the state, there's one hospital or one area where therapists get together and do stuff like this, just like the example that was given earlier.
well, okay, like I said, I'll get the rejection rate and we'll go from there. We'll see what we want to do.
Sounds good.
Thank you. All right, Lauren, you can move on to if we have another section.
Yeah, does the language to cover the CE broker or auditing verbiage, is that not all covered in this, or do we want to just add whatever other
Why
places?
don't you just delete the first sentence, because then everything else will be fine when we'll do the verifications.
What?
Just delete of item C, delete the first sentence from C to the period before in addition. Leave in addition. Yeah, take in addition out and capitalize the T. The board or advisory committee has the right to audit any questionable documentation of activities.
See, and that'll cover us in the event that one day the CE broker does notify us and say there's an issue. Or if someone does call up and say CE broker refused my CEs, we got to have a way to follow up on that complaint.
Well, again,
I meant this part, the language that to cover CE broker will be needed to add.
I think that's all you really need to do.
Do we need to add that?
Okay, well, then I guess what you want to do, and I hear what you're saying, and that is why don't you put it this way? The official tracking system or the accepted tracking system for the board will be utilized to maintain the number and types of continuing medical education submitted by each licensee.
And then the board has the right to
Right.
audit.
Yeah, and I don't want to put CE broker as the one, because if we have to get rid of CE broker, I don't want to have to change the rules.
Right.
The electronic medical record, electronic CME tracking system.
Um, the official electronic medical education tracking system used by the board
Yeah.
will be what?
Will be used to verify the number and types of continuing medical education submitted by the licensee and interface with the board's renewal system to prevent renewal in the absence of complete CME verification or completed CME verification.
Do we have this already written out elsewhere?
I think we may have put it in the Medical Practice Act, but I'd have to go back and look. I don't remember how we did it. I want to be honest.
Okay, let me pull that up real fast. See if we can just copy and paste.
Yeah, I was gonna say, if it's already in for the physicians, that'd be the thing I'd do, is just copy and paste from that one into this one.
Yeah, let me just pull that up real quick. It's loading. I'll find it and then put it in there. So I don't have to go searching for it. Right now while y'all are on here.
We're good. I did investigate that. Not more than 4 is okay.
Okay. All right, now this issue of the letters.
Dr. Kalata, help us out. The last meeting this came up, and as I recall, you and I had a discussion that we were doing away with the LRTC and the LRTR, and we were just doing LRT.
Well, again, I don't care what you call them. I care about their standing with the NBRC, okay? If we don't need to have them registered, if that's what all that, just simplify it and just use one term and we can all do it. Because a lot of this was when you had you had one certifying agency and that kind of stuff, you know, changing from different things. And so I don't care what you call them, just as long as we're utilizing the, you know, the certification agency that we all agree to.
Well, we only use one certifying agency, is the NBRC, but they're
Right.
still certified and registered. 2 different tests, 2 different
Okay, so
cut
do
scores.
they give 2 different kinds of credentials?
Yes.
Yes.
Then we have to go along with what they give. So if they give a certified and a registered, then we go along with certified and registered. If they give something different, let's do what they give, because that's the way you can track it back to where it needs to go.
I think the reason this was put in there was the NBRC would not let us use RRT, CRT in our licensure law. So
Yeah,
we,
they own that credential.
yeah, they own that
They're
trademark.
federally trademarked.
So that's why we came up with licensed respiratory therapist certified or licensed respiratory therapist registered. and you could use these letters. Now, I am not in the hospital business, so each department head has their own thing. And I'm older than dirt, so all of my credentials that I have never expire. But our new guys coming out, if they do not renew in 5 years, they're not supposed to use that credential behind their name.
Well, if it's, I mean, then we got to sit down and let Lauren and I do some research as to what the NBRC is really doing today, so that we can make it effective what we're doing today, because I don't understand how they can use the credential if it is a registered trademark that they don't allow them to use.
No, I can use it as long as I'm in good standing, and we do put good standing with the NBRC, which we only ask for that when they get their initial license. You don't have to prove you're in good standing when you renew.
Would you like us to? Why don't we do that?
I'm
Well,
in favor of that.
It opened up another can of worms years ago, but I always thought we should.
Well, okay, let's do this. For C, we will go back and check, because I can't believe you've earned the credential, you can utilize it as a credential. They may register it, it's their trademark, but you paid and took the course to use it, and you passed the test to use it. Okay? So I think that's not the issue. I think we can fix that. But the real issue is that you've identified something that I was unaware of and we can fix in the renewal. Do you want them in these new rules to be currently certified every time they renew?
I mean, we require that here, but that is not something that's not checked by their license. That's checked by our HR. But I am in agreement. So when you submit for your credentialing from the NBRC, it is essentially a lend-lease for 5 years. And of course, you have to complete your continuing education to maintain your right to use the credential. If you let 5 years lapse without fulfilling the requirements of the CMP program, either by retesting or submitting your CMEs, then you are no longer, per them, permitted to use that credential.
Now, let me
Jim-
say why you probably see a difference. Historically, Jim and everybody, we do not require physicians to be board certified. Okay? So, but we do ask if they are. However, most of your colleagues in the mid-level professions are saying we want them to be certified. So it's up to us at this point to say, do you want them to be certified, or are you comfortable when they let it go after 5 years and it's still practicing 20 years later, in those 15 years, they're competent to continue?
Jim?
Whichever way y'all go with this, it doesn't matter to me, but I just want to make sure that the terminology that's put in the application for renewal does not use the word re-credentialed. You could ask, are you in good standing? Because I'm like Diane, I'm old as sin. I don't have to re-credential. And there's a ton of us still out there that don't have to re-credential. But
And
we
you're in
The
good
majority of
standing.
my staff are
You have
grandfathered.
maintained your certification, okay?
Yeah.
And that's what we have to talk about, maintaining certification. And we can reward that once we get the exact information from the NBRC. For example, I have a lifetime certificate in obstetrics and gynecology and board certification. My certification never goes out of date, okay? And people like you and Dina have the lifetime certification. They're going to be the younger physicians, and I'm sure the younger RTs, who no longer have lifetime certification. And so what we want to do we want them to be currently certified by the NBRC? And that's a question you guys have to tell us.
My
Okay,
question for this is under the unauthorized practice exemptions and prohibitions. But this sentence, like this section C, just says that someone who is registered or credentialed and in good standing can identify themselves as X, Y, or Z, right? It's just saying something that
May
can do.
identify.
It's not unauthorized and not exemption. Could we just get rid of this and then put it in B and say that no person shall hold himself out to yada, yada, yada as being credentialed and in good standing if they're not? Like make it into a negative?
That would be much
Unless
better
they're
for the
not
syntax.
currently certified by the
Yeah,
end.
like just wrap this into B because C just has always read really different than the rest of them. Because the other two are restrictions, and this one is just a hey, if you are, you can talk about yourself this way. You know what I'm saying?
No, I agree.
I think that's a way to word it, and we're going to trust your wording and wordsmithing, but the real concept is we have to address the concept is the advisory committee of the opinion that anybody who is licensed to practice respiratory therapy should be currently in good standing / certified by the NBRC.
That's a wholly different requirement than what this one is saying. This
I
one is just
know.
saying that someone that is an
Exactly.
LRT.
You're exactly right. What they can call themselves, but we're going to take that out and we'll put that in B. And that's the real issue of what B is going to say.
Okay, I think
Well,
I'd like to table this for further discussion at next meeting because we got about 25 minutes left and we do have 2 executive items that we need to discuss at this meeting. So would this be a good point to stop, Lauren? And you work on this, you and Dr. Collada, and bring back to us?
Perfect.
Yep.
Is a committee in agreement with that?
I agree.
I agree. The semantic, this one of the things that I'm learning about this whole entire process is the literal definitions of words and semantics and how important it is. This has been quite the learning experience for me.
Lauren, how much more yellow did we have to complete in the document?
Sorry, I took it off screen share. I don't think that was it.
Okay.
That was the last
All right.
thing. And so
All right.
for the next meeting, we'll have that. We'll have this other yellow part about I'll get the language for the CE broker. I did just want to show y'all real quick. This will be quick. I won't take much of your time. What the physician's rules say for the document or it says document procedure. So licensees that should be insure with an E, not IN. You're not getting insurance, but ensure that documentation of the CME, yada, yada, goes to the electronic tracking, each licensee, and it tells them steps. So we can pick and choose from this. I'll copy and paste it and work on it into y'all's rules, and we'll discuss what we want to keep and what we don't want to keep and how to augment it for the RT rules for the next meeting.
Okay.
Thank you.
Sheila, last question before we move on the rules.
Yeah, I just want to say that for the next time, I do have 2 other items to discuss, the 4-strike rule and compact licensure as far as our rules and regs are concerned.
Okay. Dr. Collada, is there any comment from the public before we move on?
There is no public comment at this time.
All righty. We'll move back to the agenda. Item number 3, the respiratory licensure process. I know there's been a little bit of a change. I think we talked about this at the last meeting. I think some schools are experiencing this right now. And Dr. Collada and I had a discussion this week on the high school transcripts. Can you elaborate a little bit on that, Doctor?
Well, again, when I worked with the NBRC a few months ago in the compact area, we were assured that the people who come through have a college program and that college has verified their high school diploma or they're graduate from high school. So we are trying to streamline and expedite licensing at all costs. So what we want to do is say, if the NBRC says they're certified, we don't have to, it subsumes all of those things and we don't have to chase documents. And that way we're going to try and make it easy. The rules currently say high school, but since it subsumes that we're making it work because we're changing it as fast as we can.
I know there was a couple of questions that I got calls for this week on the high school transcripts. And I want to thank Dr. Collada and his staff for working to get that clarified and get those licenses issued in a timely manner, the ones that they could.
And really what happened was it was a big topic with licensing about high school diplomas for a group of licensees that don't require a college degree. And what constitutes a valid high school diploma. And I think it got a little confused in the translation, and I apologize. I probably didn't make it clear to my staff, but we fixed that. And so the real issue that we're dealing with is one of our licensing subclasses does not require a college degree to get that license. And that's really the only one we have. And that's where the problem are. And we didn't make that clear to our staff, and I apologize for that.
Thank you, Doctor. Sheila, you have your hand up. Okay, nothing. All right, next item on the agenda is changing the meeting date of the next meeting. We're scheduled for July the 15th. I won't be in town that day. So I'm looking at changing that to July 22nd, or if y'all would like to have the meeting next month, then that's fine with me as well.
22nd works for me.
Okay. So Jacinda, I don't know if you can check and let us know if the 22nd is good for all of our participants from the board.
We have that day
Let us-
available.
Okay, then we'll go ahead and schedule July 22nd as our next meeting date. The other item that we added to was compact licensure, and I think we'll discuss that at with our next rules and regs. Are there any public comments, Dr. Collada?
None at this time, sir.
All right, I'd like for someone to offer a motion for us to go into executive session.
I make a motion for executive session.
Second.
Do I have got a second by Blake? All in favor?
Aye.
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 Any opposed?
Aye.
Aye.
All right, Jacinda, can you transfers?
It's going to take a few seconds, but you'll make the transfer.
Okay. You should be able to hit the join button at the bottom right-hand corner of the screen.
Jacinda, can you let us know when we're streaming, please?
Yes, Lauren, give me some stuff to read about.
Looks like everybody's back, Raymond.
All righty. Diana, would you proceed?
In regards to case number 2025-332, I make a motion to deny licensure for this individual.
Do I have a second?
Seconded.
Second by Blake. All in favor?
Aye.
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 Any opposed? Motion carries. Is there any public comment, Dr. Collada?
There is no public comment at this time, sir.
All right, I'd like to thank everybody for their time. We made it with 4 minutes to spare. So thank y'all very much, and we'll see y'all at the next meeting.
All right, thank you.
Thanks, everybody.
Thank y'all.
Aye.
Good one.
Everyone have a great day. Bye.
Take
Aye.
care. Thanks.